Opioid use continues to dominate the news despite the fact that these medications can be misused and abused. For those preparing for oral surgery in the upcoming months, especially the thousands of high school and college students who will have their wisdom teeth removed, non-opioid pain medications are available, which can help curb the opioid epidemic that is killing 91 Americans each day, according to the Centers for Disease Control. Oral surgeon Dr. B.D. Tyner joins me right now with some important tips to know for managing pain when preparing for oral surgery. Thank you so much for joining me.
Thanks for having me, Makiba.
Now, first, doctor, managing pain for patients is a big concern for healthcare professionals such as yourself, especially in the light of the opioid epidemic. How does this epidemic impact the oral surgery community?
Well, we know in about 80% of the cases that young adults' first exposure to opioids is when they have their wisdom teeth removed. And if given a choice, 70 to 80% of these patients would choose a non-opioid option in managing their post-surgical pain, if given the choice.
That's interesting. Now, in your practice, you regularly use a non-opioid medication for oral surgery. Tell us about that.
Yes, that's correct. In the past 9 months or so in my practice, we've been giving patients the option of using a non-opioid means to manage their post-surgical pain with a new drug called Exparel. Exparel is similar to Novocaine. I'm sure everyone in the audience has had their jaw numb for a feeling at some point in their life. This medication is injected in the surgical sites at the end of the case, and it provides long-acting pain relief in the post-operative period for these patients.
Now, many people, especially young adults, are first exposed to opioids following oral surgery procedure, such as the wisdom tooth removal. What should parents know and patients prior to the surgery to help manage their pain?
Well, parents and patients should know today we do have an option to manage their pain post-operatively, which in some cases can be significant, with a non-opioid option.
That's good. Now, you've talked about the non-opioid option. Have you seen an increase in more patients asking about it and more parents asking about it in your practice?
Yes, we have. As the opioid crisis has been become more and more visible in the media, you can't open a newspaper or turn on the TV or open your email without seeing another article about the opioid crisis. So more and more patients are aware that opioids can be a problem. We know that up to 10% of patients who are given an opioid prescription at some point will have an addiction or an abuse problem. So if there's an option to managing your post-operative pain without these opioids, patients will benefit greatly from this.
Absolutely. And what is some last advice that you have for both parents and patients when they have to encounter a surgery in regards to making sure that they get the non-opioid option?
Well, the take-home message here is there's a website called oralsurgeryprep.com, and I would encourage patients or caregivers who are contemplating having this surgery this summer to go to that website. There's several questions on there that are recommended. You can download those and print those and take those questions to your preoperative consultation, and so you can have a frank discussion with your surgeon about the options of managing your post-surgical pain.
That's great to know. Thank you so much for that. And again, for more information on the newest developments, especially with non-opioid treatments, visit www.oralsurgeryprep.com. Thank you so much for joining me today, Doctor. It's been a pleasure.
Thanks for having me, Makiba.
Have a wonderful day.
Thank you.